most meditation practices involve shifting from doing one thing to maybe you're walking, maybe you're open eyes, but typically I think people either sit or lie down, close eyes, and start focusing on their breathing and trying to quote unquote get present. Is there anything?
Although the kind of practice that I most often do is actually with eyes open. But
really?
Yeah.
Oh, well, then just tell us about that. What would be a good, let's use the parallel to cardio again. I would say if somebody is really out of shape and wants to get in shape, I would say the first thing is take 2 20-minute walks a day. Mm-hmm. And then we could talk about getting on a exercise bike and then maybe doing some resistance, or you start layering things in, right? But what would be the equivalent of the 2 20-minute walks a day for meditation?
So this is the protocol question, I guess. It's, I would say it's really important to start modestly, and we often will ask a person, what's the minimum amount of meditation that you think you can commit to every single day and do it for 30 days consistently?
5 minutes.
Perfect. Whatever that number is, perfect. Start with that. And then the next question is, are you comfortable doing it formally as a seated practice, or would you prefer to do it while you're walking or while you're doing another non-cognitively demanding activity? It could be commuting. It could be washing the dishes. There are lots of those kind of activities that we often do on a daily basis that you can actually intentionally use your mind in this way while you're also doing those activities. And by the way, we actually have really good data on this, that at least for beginning meditators, it doesn't matter if you're doing it as a formal meditation practice or as an active practice, the benefits are absolutely comparable.
And what are those benefits?
So if you do it for 30 days and you do it just 5 minutes a day, you will see a significant reduction in symptoms of depression, symptoms of anxiety, and symptoms of stress. We've shown that repeatedly in randomized controlled trials. You'll see an increase on measures of well-being or flourishing, and we can talk about what those actually mean. You can even see, just with this amount of practice, a reduction in IL-6. IL-6 is a pro-inflammatory cytokine that is important in systemic inflammation. And with just this minimal amount of practice, you see a significant reduction in IL-6 over the course of 28 days, 5 minutes a day. We've actually seen changes in the microbiome, and we've seen changes in the brain. With just this minimal amount of practice. But the important point is that you're doing it every day. When people ask me what's the best form of meditation that they should do if they're just beginning, I say the best form of meditation that you can possibly do is the form of meditation that you actually do. So figure out what that form of meditation is and then stick to it. Do it every single day.
I love this. I actually am going to challenge our podcast audience to 5 minutes a day for 30 days. I'll put something out on social media. Rob, please remind me to put something out on social media to do 5 minutes a day for 30 days, because what you describe are significant health effects.
Yeah, totally.
And as you describe them, it made me remember this set of experiments from neuroplasticity. Do you mind if I share these?
Please.
Because this is a theoretical / practical question as we move into these protocols. But before we do that, what should we call this protocol? It's the Richie Davidson.
5 minutes a day.
5 minutes a day. Richie's 5. It's the Richie's 5 meditation. I'm going to start that. Later I'll share what I've been doing, but it's not even that. I've been doing 10 breaths upon waking. 10 breaths before I get out of bed. I'm like, if I can just do 10 breaths of focused meditation before I get out of bed, the whole day will go better, and it tends to.